Welcome back. What if Chicago's top hospitals came together to fight breast cancer? Well, that's exactly what's happening right now with the Chicago Breast Cancer Consortium, right in time for October, which is Breast Cancer Awareness Month. And joining us now is Dr. Ruta Rao, an oncologist with Rush University Medical Center, and Kirsten Chernowski, Executive Director of the Lynn Sage Breast Cancer Foundation. Very exciting project. Thanks for being here to talk about it. So first of all, what hospitals are involved here, and what does this mean, this consortium on research for breast cancer, for treatment and for research going forward?
So it's a first-of-its-kind regional model that brings together Rush, University of Chicago, and Northwestern, convened by the Lynn Sage Breast Cancer Foundation, in order to provide patient clinical trials across all three sites. And we're ensuring that those trials are accessible and equitable to everyone through a patient support fund that will help reduce barriers and ensure greater participation.
So Dr. Rao, is this a problem with oncology and cancer treatment that maybe these hospitals are in silos? Does it help to have this collaboration?
Yes, absolutely. What we want to do is open trials across the institutions and at all of our satellite locations as well, so that patients can stay within their healthcare teams and yet have access to the same trials that are available at all three institutions.
And you mentioned equity and making it accessible for folks that maybe otherwise couldn't afford it. Does that mean if you're on Medicaid or if you don't have health insurance, you'd be able to access funding?
So our patient support fund looks more at transportation, childcare costs, any of those barriers that make actually getting to the hospital a barrier to participation.
And is that it tends to be a big barrier for people?
Absolutely, especially with the timeliness of clinical trials.
Dr. Rao, what are some of the clinical trials right away that are being worked on that might give some patients hope here?
One of the trials that we're looking at right now is already open at Northwestern, and University of Chicago and us at Rush are in the process of opening it, looking at a novel way to treat estrogen receptor positive metastatic breast cancer.
And can you tell a little bit more about how that would work?
So we're looking at a compound called elacestrant, which is a targeted therapy in the metastatic ER positive, estrogen receptor positive breast cancer setting. And what we're trying to do is open the trials so that the same trial that's going on at Northwestern can be open at our institutions. Our patients won't have to travel, change their entire healthcare home to another institution to join the trial. And
Kirsten, what are some of the other promising areas of research going on right now?
You know, of course, there's the progress with AI, but a lot of what's happening similar to this trial is looking at different drugs that have been approved for individual uses on their own and bringing them together to see if there can be, additional gains through those.
And Breast Cancer Awareness Month, October, I mean, the thing that I always take away is mammograms and early detection. Is that the main message that you want to get across?
I think, of course, it's important to have early detection, but I think once patients are diagnosed with breast cancer, it's important to get the appropriate treatment. We live in a city where there's wonderful medical centers, and each of these medical centers has great breast cancer teams, multidisciplinary teams. I also think clinical trials are the way that we move our field forward. We don't know which drug is best for which subtype of breast cancer until we investigate in clinical trials, and we can really move the field forward that way.
Kirsten, as a survivor, how does this make you feel that this consortium is getting together and other survivors, other patients going through this right now? What does it mean for them?
It's really exciting. It's especially exciting for me because not only am I a survivor, but Dr. Rao is also my oncologist, which I didn't know until joining the foundation, and now she's also the lead at Rush for the Chicago Breast Cancer Research Consortium. But it just gives so much hope, which is really invaluable when you're facing a diagnosis.
All right, that's a great story then. So you're reunited on this mission to help so many other women with this horrible disease. Breast Cancer Awareness Month. Thank you for your work, and we appreciate it. Rush, Northwestern, U, Chicago, the three biggies, the three big research hospitals.
Yes.
Coming together, great. My thanks to Kirsten Chernowski and Dr. Ruta Rao, and that is our show for this evening. As always, keep up with all you need to know at fox32chicago.com and with the Fox local app. We are back tomorrow night on the Chicago Report. Have a great evening.